Hey guys, this is Melissa Stockyj, a nurse injector at Cynthia Gregg MD Face and Body Specialist, coming to you virtually. This is actually a pre-recorded presentation for our Patient Appreciation Day. At the very end, I will be coming live to answer any of your questions. So make sure to ask as many questions as you like, because at the very end, I'll come live to answer them all. So today's topic that I'm going to be discussing is Botox to the rescue. I just want to cover what Botox is. You may have heard of Dysport, Xeomin, Botox. Those are all neuromodulators, and what that means is they are all used to soften muscle contraction. So their one name, Botox, I'm going to be using consistently, but it encompasses the neuromodulators that we have at our office. Now keep in mind, whatever one we use on the patient is the provider preference based on your history and based on the area that we're injecting. So who should be injecting Botox? So at our facility, Cynthia Gregg MD Face and Body Specialist, we have 3 nurse injectors who are all CAN certified, and what that means is just an additional accreditation through the International Society of Plastic Surgical Nursing. We've all done it for many years, and it's our primary job. So neuromodulators, what are they? As we've said, Botox, we're just going to simplify and call it Botox throughout the presentation, but it's essentially the injection that softens muscles that cause lines on the face. And I'm going to talk about some of those areas. So first is crow's feet. And crow's feet are those little pesky lines that happen around the eyes, and that happens from constant muscle contraction. Over time, those little lines get ingrained in the skin, or you'll notice that makeup will sit in the lines. And so when Botox is put into that area, you can notice a softening of the space, but still being able to use your expressions and your animations. As you can see, this picture here shows a before and after of this young woman. And pretty much that's what you can expect from a crow's feet injection of Botox. Now, depending on the severity, and we talk about that at your consult, we'll discuss dosing, and we can also discuss if Botox is the right neuromodulator for you. Here's a male. I always like to throw in a male picture because sometimes people don't think men get Botox cosmetic or get a neuromodulator, but they do. And so men, as you can see, it's very flattering when males get their crow's feet injection. I like when my husband gets it done. It's very subtle, but it reminds me, we've been married about 14 years, just reminds me of his face, you know, several years ago. He's still very handsome and distinguished, but it does soften the male face. Next is the dreaded 11s, and this is probably the #1 injected area, I would say, in a female face, and there's 2 reasons. One, this muscle group is notorious for making us look angry. I constantly hear patients say, Melissa, people think I'm angry, I'm not angry, or I look at my computer all day long and I'm getting headaches, or my husband says, why are you making that face? These are called 11s, or I like to call it the scowl brow. But Botox in this area lifts the mid-face, so it lifts the medial brow. So what happens is not only does the angry furrow soften, but you get this nice little subtle brow lift. So that's why when Botox is done correctly, we just look fresh. We don't look frozen, we don't look like we can't make a face, but we just look lifted and fresh. So I really love doing this area on women and men. And here's a picture of Botox for the forehead. And as we age, you know, over time, raising that brow, I'll see a lot of people who are on their computer all day long and they're lifting the brow. These lines will start to get ingrained on the forehead. So that's another area that we can inject Botox. So when it's conservatively done, it just goes from a very kind of textural component to a smooth component. You can still lift brows, you can still make animation, but the lines that exist when you raise your brows are softened significantly. Here's kind of a picture I wanted to include on the left side. The right side's talking about fat. But the reason I want to include this is because, not that I want everybody to learn every muscle of the face, but know how detailed and meticulous this injection is. That's why it's very important to go to an injector who has done this for many years. We know these muscle groups, we know your muscle groups, and we assess you based upon what muscles need injection. and place it appropriately. I just want to stop midway just to remind you that I will be answering questions at the end. This is pre-recorded, but think of some questions throughout the next part of this video, and I'll come live to answer them. So this, you can barely see. This is the only stock photo I could find of this muscle, but this muscle is called the depressor anguli oris. I won't bore you with details. It's the muscle that pulls down the angle of the mouth. We can inject Botox here. Guess what this muscle does? My best friend back in Michigan allowed me to use her photo of her depressor anguli oris, or her little sad face muscles, as we call them. Jennifer has never received Botox. She lives in Michigan. She wishes she could live down here so she could come to Dr. Greg's office. But you can see that kind of frown, sad face is what we call it. And so when Botox is injected in this muscle group, what happens is the angles of the mouth lift. And so we look younger by means of not pulling down on that depressing muscle. I wanted to include this photo. This is our beautiful patient coordinator, Beth Shelley. She is, first of all, she's beautiful, she's smart, and she schedules surgery for Dr. Wu and Dr. Greg. But I injected her depressing muscles, and I also injected her neck bands. So both of these muscle groups pull down the face. They pull down our jowls, they pull down on our neck, they make bands on our neck. And if you look at the progress of just Botox injection on her low face compared to her before and after, it's pretty significant. Again, she's gorgeous either way, but you can really see the contour of that muscle lifting back up. So it's quite a nice injection. This, again, it's hard to find stock photos that we can use on presentations, but this is a muscle that goes around the mouth. And it's the vertical lip lines that get people every time, and they call them smoker's lines. And you'll notice lipstick bleeds into the line. You know, patients will say, Melissa, I've never smoked a day in my life. Why on earth do I have these lines? It's just constant contraction of a muscle. So when we inject a conservative amount of Botox in that area, you can see the little itty bitty lines soften. Not only does it soften the itty bitties, but it prevents the deepening of the lines. The other added bonus to this injection is a little bit of fullness to the lips. Now this isn't a dermal filler fullness. What this does is when we relax that muscle around the mouth, you get a little bit of aversion. So sometimes we do it on young folks just to give them a little bit of fullness without doing a dermal filler. The next one is called the masseter muscle. Again, this muscle is located in the back of the jaw. It's strong, it's used for chewing, clearly. But what happens is when people have really strong masseter muscles, they get this boxy-like appearance on the back of the jaw. Or sometimes they get TMJ pain, because that muscle is so dang strong, it will contract. So I had to show a photo that kind of shows and simulates the boxy appearance pre-Botox and the angular appearance post-Botox. So it's quite a nice injection to slim jawline, but also a secondary bonus is it allows less of a force for somebody who clenches their teeth. So Botox to the rescue. Where else can we inject Botox? We talked about the muscles of the upper face. The one area I didn't mention is the nasalis. We call those bunny lines. And those muscles are located on the lateral parts of the nasal bridge. And what happens is, right now, I mean, we've been in a shelter in place, so I haven't had Botox, but you can see it's kind of like a snarl. And so when we inject those lines, it softens without, inhibiting animation or making you not be able to make expressions. Hyperhidrosis, excessive sweating of the underarms. Believe it or not, Botox can be used in the underarms. And the great thing is that lasts up to 6 months. Migraines, sometimes the severity of migraines, when one has migraines and has that tension between the brow, Botox, when you inject it between the brow, just softens and alleviates some of that. TMJ, we talked about that dang masseter muscle. Sometimes if it's so strong, it can become strong enough to cause pain and temporomandibular joint pain. and depression. And I won't go into all the clinical studies, but there have been clinical studies linked from receiving Botox between the brow and reduction in depression. So I just put this up because I thought it was really nice, just kind of like we're all in this together. This pandemic has been extremely trying for a lot of people. And we all here at Dr. Greg's office and Dr. Wu's office have been doing everything we can to stay engaged, because it's really important to stay engaged and communicate with each other and check on each other. So I will end the presentation, and if you have any questions at all, I will be coming on live to answer them.